Welcome to this video about celiac disease. Celiac disease is a serious autoimmune disorder that affects the small intestine. It occurs in genetically predisposed people where the ingestion of gluten leads to damage in the small intestine. Let's dive deeper and explore what it is, what causes it, and how it's managed. The exact cause of celiac disease isn't fully understood, but it's a complex interplay of genetic predisposition and environmental triggers. The primary trigger is gluten, a protein found in wheat, barley, and rye. In individuals with celiac disease, gluten triggers an immune response that damages the small intestine. Genes involved are the HLA-DQ2 and AQ8. Having a family history of celiac disease significantly increases your risk. Some studies have also suggested that early childhood infections or changes in gut bacteria might play a role in the development of celiac disease. So, what exactly happens inside the body? When someone with celiac disease eats gluten, their immune system mistakenly identifies it as a threat. This triggers an immune response that targets the lining of the small intestine. The small intestine is covered in tiny finger-like projections called villi, which are crucial for nutrient absorption. The immune response causes inflammation and damages these villi, leading to villus atrophy. This flattening of the villi reduces the surface area available for nutrient absorption, resulting in malabsorption and a variety of symptoms. Celiac disease affects people worldwide, but its prevalence varies geographically. It's estimated to affect about 1% of the population, although many cases remain undiagnosed. It's more common in people of European descent and in individuals with other autoimmune diseases, such as type 1 diabetes and autoimmune thyroiditis. Women are also more likely to be diagnosed with celiac disease than men. The age of diagnosis varies as well. It can occur in infancy, childhood, or adulthood. The signs and symptoms of celiac disease can vary widely from person to person, making diagnosis challenging. Some common symptoms include diarrhea, abdominal pain, bloating, gas, and fatigue. Malabsorption can lead to weight loss, anemia, and nutrient deficiencies, causing symptoms like osteoporosis, skin rashes, and nerve damage. In children, celiac disease can cause growth delays, failure to thrive, and irritability. Some individuals may experience no noticeable symptoms at all, a condition known as silent celiac disease. Because symptoms vary so much, it's easy to misdiagnose it. Diagnosing celiac disease typically involves a combination of blood tests and an intestinal biopsy. Blood tests look for antibodies that indicate an immune reaction to gluten, such as anti-tissue transglutaminase antibodies or anti-endomeasial antibodies. If blood tests are positive, an upper endoscopy is performed to obtain a small tissue sample from the small intestine. This biopsy is then examined under a microscope to assess the extent of villus damage. It's crucial to continue consuming gluten until the diagnostic tests are completed, as a gluten-free diet can mask the signs of celiac disease and lead to a false negative result. While there aren't distinct types of celiac disease in the traditional sense, it can be classified based on the severity of symptoms and the presence of complications. Refractory celiac disease is a rare condition where symptoms persist despite following a strict gluten-free diet. This may indicate other underlying issues and requires further investigation. The cornerstone of celiac disease treatment is a strict, lifelong gluten-free diet. This means avoiding all foods and products containing wheat, barley, and rye. This requires careful label reading and being vigilant about cross-contamination. A registered dietitian can help you navigate the gluten-free diet and ensure adequate nutrient intake. In some cases, individuals may need supplements to correct nutrient deficiencies. For refractory celiac disease, additional treatments such as corticosteroids or immunosuppressants may be considered. Currently, there's no way to completely prevent celiac disease in genetically predisposed individuals. However, some research suggests that early introduction of gluten into an infant's diet, while they are still being breastfed, might reduce the risk of developing celiac disease. More research is needed to confirm this theory. With a strict gluten-free diet, most people with celiac disease can achieve complete symptom relief and heal their small intestine. Early diagnosis and treatment are crucial to prevent long-term complications, such as osteoporosis, anemia, and an increased risk of certain cancers. Recent research is focused on developing new therapies for celiac disease, including enzyme therapies that break down gluten, vaccines that desensitize the immune system to gluten, and medications that block the immune response to gluten. These advancements offer hope for improved management and potentially even a cure in the future.